Good afternoon. My name's DJ Wells. I'm from the Mensah Research Institute and Mensah Medical. Thank you for tuning in. I see folks are starting to tune in now. This is our ongoing series on things to help you negotiate the craziness that has become our new normal as we negotiate this pandemic, this COVID-19 pandemic, and staying at home and all of the new things that we've had to endure as part of our battle against this pandemic. We're joined today, as we were last week, by Dr. Albert Mensah and Dr. Perry Passaro. Dr. Mensah of Mensah Medical, founder of Mensah Medical, and an expert in nutrient therapy. Dr. Passaro of the Anxiety and Depression Center in Southern California and a cognitive behavior theory expert. The two of them are sharing their insights with us today on ways that we can cope with the anxiety and the depression that are developing as folks go through this pandemic, as people are taking in new information, as people are forced to shelter in home and those types of things. As we did last week, we're going to allow Dr. Mensah and Dr. Passaro to have a conversation for about 30-40 minutes and kind of share some specific insights that they prepared for today's specific conversation. But then we plan to open things up for your questions. We'll do a live question and answer session. So as you have questions of Dr. Passaro, of Dr. Mensah, please do use the Q&A tab at the bottom of your webinar screen there. Type in your questions and we will get those questions addressed and answered as quickly as we can as part of the live broadcast today. And then also recognize that in case you missed some of the session today, if you have to leave, if you want to come back and review some of the great information that's going to be shared today, or if after watching you say, you know, my friends, my family, they all need to see this as well, then please do check out the Mensah Medical Facebook page. We will be posting links to a replay video of today's webinar session on the Facebook page. It'll be uploaded to our YouTube channel. So you will be able to access this even if you can't stay with us for the full time that we're here today. We're scheduled to go an hour, but because this is our last session for now with Dr. Passaro, we are willing to stay a little bit late if we have a few extra questions. So by all means, get those questions into us and we will get them answered. Last week, Dr. Passaro and Dr. Mensah spoke specifically about anxiety and things that we can do to kind of overcome the anxiety that are part and parcel of being in this kind of global emergency that we're dealing with, and also just the changes to our normal routines. Last week, Dr. Passaro indicated that while we focused on anxiety last week, we're going to focus a little bit more on depression this week. So without belaboring the introduction any longer, I'm going to turn things over to Dr. Mensah and to Dr. Passaro and let them share with you some specific things that they had in mind. And again, please do type your questions in. We'll get them answered after Dr. Mensah and Dr. Passaro have gone for about 30-40 minutes. We'll get to your questions right away. So Dr. Mensah, Dr. Passaro, take it away.
Thank you, Mr. Wells. First of all, I want to share with everyone, this is really a tremendous honor to have Dr. Passaro on board. We didn't really talk about how we actually met, at least were introduced to each other, but it was through his never ceasing capacities to explore further and to learn more through a patient that he had that the two of us were introduced. And I knew there was something very special about this gentleman as we were talking. And it came to me that we needed to hear and learn more from him. So this is how this kind of started. And Dr. Passaro, I want to thank you for all of your great wisdom and for that lovely meditation technique that you gave us last time at the end of the hour. And we're really just thrilled, quite honestly, to have you here. So we just want to share with you what a great time we had, and we're really excited and looking forward to more. So without really further ado, Dr. Passaro, I'm going to let you take it from here.
Thank you. Well, it's an honor to be here working with both of you. It really is an honor. So what I thought we would do today is just quickly review what we spoke about last week, and then move directly into understanding depression and how we can help ourselves to get out of depression. So I want to have some very practical tools for everyone. I'm going to start by putting up a few pieces of information here. And let's see if I've done this properly or not. 1 second, and okay. So what I want to, I had a simple pen and paper drawing of this last week, but I wanted to put up here some of the really important things that we need to keep in mind, whether we're dealing with anxiety or whether we're dealing with depression. And that is this idea that the mind does not really want to abide in the here and now. When we're anxious and worried, we're in the future and we're predicting. When we're in a depressive state of mind, we tend to be in the past, replaying things, going over things that cannot be changed. If we watch our minds carefully, we'll notice that we really tend to abide in the past and in the future. And both of these are very problematic for mental health. One of the very best things that we can learn to do in regard to mind training is this idea of living more in the present moment. Within that present moment awareness, it allows us to observe ourselves and observe our thinking, our emotions, and our behavior. And what's so important, particularly in regard to depression, is that we learn to witness this without judgment. When we add in judgment, it compounds the depression. And we want to be able to cultivate compassion for ourselves and others. There's a tremendous literature. We could spend hours in sessions like this just talking about the need for compassion, particularly in depressive states, and how that can be cultivated. But I just want to point out that if we can't forgive ourselves, we're going to have a very hard time forgiving anyone else. And everyone's life involves past mistakes that we wish that we could change, but we can't. So we have to learn from the past, but we also have to put it behind us. And we want to be careful, because what happens when we live in the past, that past then tends to predict our future. We think, well, if I made a mistake in the past, then the future will never improve for me. And the young man that brought Dr. Mensah and I together, this is an example of how his mind works, unfortunately, at this point. But this is what we're working together to change, both from therapy, cognitive therapy, as well as nutrient therapy, because there is certainly a biological component to this as well. And that's why we're trying to work as a team in this integrated way. But the training is that if we can keep the mind in the present moment, everything will improve. And as I said last week, living in the present moment doesn't mean that you don't take time to plan for the future. It's that you don't live in the future. You live in the present moment, because that's all that we have.
Dr. Passaro.
Yes, please.
It's something very, very important. And I'm not sure we emphasized that last time. Judgment. No matter what phase of existence we're living in, judgment carries a huge weight and a huge burden for many of us. It's gosh, what am I thinking? What am I going to do? Is that going to be a good move or a bad move? We're judging ourselves, and that creates a negative downward spiral. But certainly that past, what you just said really sort of struck a chord with me, because with so many of our patients and the people that we encounter, it's thinking about past issues is one thing. If there's a positive spin on that past issue, people tend to do pretty well. But if there's a negative spin on that past issue, it becomes the anchor that doesn't allow them to progress. It doesn't allow them to move forward. And I think looking at the idea of judgment and judging ourselves is a very, very key part of limiting the effects from the past and allowing us to be able to move forward. So we have to be careful and really cautious about that. And as we are careful about judgment for ourselves, certainly there's judgment with regard to others. Judgment is a huge part of our culture, our society, everything from shaming individuals to a lot of the abuse that is occurring now by way of internet issues, posting. There's all sorts of things that really fall under the umbrella of judgment. And I think we really need to be more cognizant of that concept. So thank you so much for bringing that up. Very important.
Absolutely, it really is. And one of the things that we notice when we are living more in the present moment and trying to keep the mind on one thing at a time with full attention, as we've discussed, it allows us to observe some of the habits that we live in, but don't really notice, particularly when we're caught in the past and caught in the future. So the more that we live in the present moment, the more that we live in this consciousness of trying to do one thing at a time with full attention, these patterns can present themselves to us, just how much judgment we do of ourselves, of others, as opposed to just being observers and witnesses. There's often judgment, usually judgment tied to it, and it's a deep-rooted process of the brain. It's a survival mechanism that goes back a long time, depending upon how you want to look at neural evolution. But we have a brain that's not wired for happiness per se. We have a brain that's wired for survival. And so that's where the judgment comes from. And so what we have to do is rewire our brain so that we can live in a much more harmonious way, because we don't need to live in that place of survival anymore.
Thank you, Dr. Passaro. Thank you.
Oh, absolutely. Thanks. You're welcome. Thank you. What I also wanted to talk about, and I think this is such an important thing, particularly in regard to treatment for both anxiety and depression, particularly depression. We talked last week about activity scheduling being a very important thing to do, particularly for people that are isolated. We talked about how anxiety tends to create avoidance of things. And so depression does that as well. Depression isolates people, creates avoidance, creates this living in the past, and then making predictions about the future. So we talked about this idea of activity scheduling, and what I wanted to do was list a few points that we didn't go into last week that I think are very important in regard to how we help get ourselves out of these negative states, these negative emotions. One of the ways that we do that is by showing up for others, serving and helping in any way that you can. It's so important in regard to trying to get ourselves out of our own negative mental habits. If we can help others, we will be helping ourselves even more. This idea of growing up by putting others first, to trying to not be selfish, to overcome that wiring in our brain that says more for me and less for you. We need to keep in mind that as we're really trying to grow as human beings, we want to remember everyone is right, everyone has some truth, and we want to accept and recognize that. No one is wrong all the time, including us. And so we need to keep these kinds of concepts in mind if we're going to be living a more harmonious life that is less grounded in negative thinking and negative experiences. And we need to clean up. We need to honestly introspect and work on ourselves when we do find these negative traits about ourselves that we don't like. Instead of telling ourselves, oh, I can't change, I'm not capable, it's too much for me, we have to identify these and then work on them, either on our own or with the help of others. And I want to talk about how we can do that in a manageable way, because it does sometimes seem overwhelming. I want to talk next about activities that can really be beneficial to us, that help us to live by our values. The challenges that we're having right now are going to put us in a situation where we can either live in ways that might result in regret later on, or in ways that are now very aligned to our values that can help us live the life that we're meant to in these difficult times. To do that, it's so important for us to realize that the external world does not need to negatively impact our interior life. We can find peace within ourselves even when it doesn't exist outside. And in this world, that's going to happen not just now, but at other times. And we need to have this idea in mind that I don't need to let the exterior world completely drag me down. I can find a place within myself, within my interior life, that will not be affected by the challenges of the external world. Some of the ways that we can work on challenges is by breaking, I talked last time about a fear ladder. And so the idea of breaking things down into small, manageable steps. This is behavioral medicine. So if someone is depressed, then asking them to exercise can be really a task that to them it seems overwhelming, but we know very clearly from the literature, one of the best things that people with depression can do is to exercise. But when you start to tell them about what those protocols look like and how much exercise they really need to do to be effective, the brain moves into something called all or nothing thinking, black and white thinking, and then we just go, it's too much, I can't do it. So here's a simple example of something. There's an app called the Johnson & Johnson, and I don't get paid by Johnson & Johnson, the Johnson & Johnson 7-minute workout app. And it's a wonderful way for someone just to start. It's like, oh, well, anybody can do 7 minutes. And then it's a beautiful thing. It has levels. It's very well instructed. There's a warm-up activity. There's a cool-down activity. So you get some stretching in there. So if you want, it might be 12 minutes. And then the idea is that you go, well, I can do that. And so, well, maybe I can do a little more. Maybe I can do it again. Maybe I can do it twice a day. It's about finding a place where you can start and begin and say, yeah, that I can do. And that's what a good therapist does with their clients, is they find a place that they can begin and there's an agreement there. But you can do this on your own as well. Socializing is something that's also very, very important. And one of the things that I find a lot in my practice are people that with family members that no longer speak to anyone because they have very different political views or very different religious or spiritual views. And so there's no dialogue or communication that goes on now. So during this time, it's a wonderful opportunity to reach out to someone that you may not have spoken with recently. And then this idea of serving and sharing. If you have things that maybe, maybe I did take too many things from the store and I have extra, and I should check with my neighbors or my friends and see if maybe they need some of the things that I have. These types of activities lift us up, and that's what we need when we're depressed. So there are small things that we can do that can have a big impact on our emotional state. I also want to talk about faith, because this is clearly a season of faith. In Judaism, Passover just occurred. In Christianity, of course, this is Good Friday, and my wife told me the other day that I think I don't know that this is accurate, but someone said this is also Buddha's birthday. So we've covered 3 of the world's major religions this weekend. So the idea of faith is not just religion; it can also be spirituality. Without religion, but for many people, their faith is in science. But the faith that I want to talk about is this idea that comes back to what Dr. Mensah stated so clearly about self-compassion. We need to have faith in ourselves. We need to cultivate faith within ourselves so that we can have faith in the nutrient therapy, and faith in Dr. Mensah's work with them, faith in the therapy practices, but most importantly, faith within ourselves that we can get better and we will get better. Very
Mhm.
important to cultivate that. Very important to cultivate that. Okay. And so the idea here is that behavioral experiments are how we go about doing that. And a behavioral experiment would be the example that I talked about a little earlier of that 7-minute exercise app. Now,
Dr. Passaro, I,
yes.
I just want to jump in here very quickly to say, um, you've made this particular form, this activity schedule, available on your website. I believe you mentioned it last week when we spoke. So I want to point that out again to folks. You've done a wonderful job here of filling it in with kind of the 30,000 feet view,
Hmm.
letting folks know the overview kind of ideas that should go in each of those boxes. But this form is available for folks to use where they can put their individual and very specific ideas and activities in. Is that correct?
That is correct. Thank you so much. Yeah, that's something that I wanted to say, so I appreciate that. Yeah, absolutely. If people go to our website, and I'll jump to that in a few minutes to see so they can see where it is. But our website has these forms. They're available at no cost, and they come from a book called Mind Over Mood, which was written by my friend and colleague. We worked together at the Anxiety and Depression Center. Um, and it's a book that he wrote. It's an international bestseller called Mind Over Mood. And so the way we've structured things at our center is that we have a self-help program, which is this book, Mind Over Mood. We have a group-based assistance that we can provide to people. Um, and now normally that would be done in our office, but now it would be done telephonically. And then we have individual help for people that feel that they need that level of care, but there are 3 levels of care. And so I will help people find where they can get these forms. So this is a blank form, and this is where it's so important to lead a balanced life and to be active. We want to use something like this to create the structure of when will I go to bed? When will I get up? When will I exercise? When will I make sure that I'm, taking, my prescribed nutrients? When will I follow the protocols that, doctors have given to me? When will I spend time with family? When will I make that call to my difficult relative? That's what this is really designed to do. So let me strongly suggest that. It's certainly a big part of what we do for treatment. The next thing I'd like to point out now is I'd like to talk a little bit about what we know of depression. And we understand, as I said before, that anxiety on the left side is about danger, vulnerability, threats, and catastrophic expectations. The what if? What if I get, this virus? What if one of my loved ones get this virus? And then what happens is we get caught up, as I said last week, we get caught up in that, and we're living in the future in fear. And then we're not really fully present and available. And when we're not fully present and available, we're not going to be making the best decisions in the here and now to prevent the fear happening. So what we want to talk about more today is depression, which is something that we understand really well in cognitive therapy, which is called the cognitive triad of depression, which means a negative view of ourself, a negative view of our future, and a negative view of our life in the moment. So past, present, and future all tend to be very negative. Now, what we understand in this model is that there's a connection between thoughts, moods, physical functioning or sensations, and behaviors. These things are all interrelated. They're all interrelated. They all feed off and build off one another. Let me show you a little bit how. So if you can begin anywhere, but let's begin with thoughts. If the thought is, I'm no good, no one likes me, I fail at everything that I try to do, and things are never going to get better. That thinking alone will now cause the negative moods of being depressed and irritable and sad. Those moods then create these changes in functioning, sleep disturbance, eating disturbance, low energy, and then actual changes in brain chemistry, which Dr. Mensah could talk about, how the mind and how the emotions actually affect the brain in negative ways, and what the therapies that we're talking about today are designed to reverse that damage. And then the behaviors that we've talked about: isolating from people, very little activity. When you think about the activity schedule I just showed, not completed. And then a lack of participation in the joyous activities of life. So here's how we try to help people get out of this in cognitive therapy. We use a technique called thought records. And as Mr. Wells said, these are on our website at no charge and in the book. And so what you do with these thought records is anytime you have a very strong negative emotion, a difficult sensation, or powerful negative thoughts. So negative thoughts, negative moods, difficult negative situations. That's the time where you want to use these as a way to gain further insight. It's a journaling activity that doesn't just have you telling the story of woe is me, it's helping you get out of the story of woe is me. So, situation that's here, there's an example of, it's preparing for Thanksgiving. And then the feelings that are rated here: sad 85%, remorseful 80%. And then why? Here are the thoughts. Thanksgiving is a sad time. I have 2 grown children who live out of town with their families, and I don't get to see them as often as I would like. Thanksgiving is the beginning of the season where families should be together. I'll never be a family like that again. My life will never be as good as it once was. This could be, a thought record of someone who's older and their families have moved away. This would be a very common scenario. So those are the first 3 columns of the thought record. The next 3 columns of the thought record are what evidence says that my thinking is true, my negative thinking? What facts say that it's true? And is there any evidence that says my thinking is not as true as I think it is? And then this is the part that's so difficult for us to learn to do. We're great at finding evidence that says I'm right about my negative thinking, but we're not very good at challenging our thinking and saying, well, what if I'm wrong? And if you step back for a minute and you think about, one of the things that we mentioned briefly last week in regard to challenges in families, if you think about the emotional challenges that families can sometimes have in this situation that we're in, is one of the ways that you help to diffuse those challenges in a family situation is you stop confirming that you're always right, and you become open to the idea that maybe your significant other could be right. But our brains are really not wired to do that. We have to train them to do that. That the idea of being open to, wow, I might be wrong. And then based on this evidence, is there now another way to think about it? So what we try to help people do with these thought records is to develop questioning skills for themselves. What am I thinking? What's the evidence that my thinking is true? And based on this evidence, is there another way to think about it? I talked last week about the best, the worst, and the most likely that could happen. That's really such an important tool, because when we're depressed, we tend to stay focused in what's the worst that could happen. We need to look at all 3. We have to force our mind out of these negative patterns. And we can do that with thinking as well as behavior, as well as medical treatment. So here's an example of an activity schedule that's been completed, and it has a rating from 0 to 100 about how the person was feeling in regard to, to their anxiety and depression when they woke up. So waking up 60% depressed, 60% when showering, but walking and then having breakfast, the depression goes down to 40%. So you see how activity improves it. Playing golf reduces it. You can see that went on for a while, but it took it from a 60 to a 40. Then having lunch with a friend, maintains it at a lower rate. So, and then you notice that activities of staying in bed on the next day actually increase the depression. So you can see how activities, can really change it. So you can see the very next day, the depression is higher. And then socializing reduces it dramatically from an 80 to a 20. It helps us see then through these behavioral experiments that I talked about, how we can make things better, both from a thinking standpoint and a behavioral standpoint. We can learn so much from these schedules by going back and looking at them and saying, how did my mood change during the week? What types of patterns did I notice in myself? Perhaps the less active I am, the more depressed I am. The less social I am, the more depressed I am. These are the kind of things that we could learn, and then that helps us to make informed decisions as we move forward in life. And I think everyone can see that these are tasks that can be learned. We can learn these on our own with just a little bit of guidance from something, like the workbook. Now, this is a blank thought record. I'm sorry, yes, this is a blank thought record. So I wanted people to see this as it kind of lays out across the actual page. And again, this is on our website. But here you have the situation, negative moods, negative thinking, facts that support the negative thinking, facts that don't support my negative thinking, balanced thoughts, and then re-rating the moods. And what we're trying to do is to reduce the numbers that were on the moods from the second column onto the seventh column. So if we were 80% depressed over here and we're 40% depressed on column 7, that shows us, wow, just by changing my thinking, I was able to change my mood. That's powerful. And that's how we can construct faith in ourselves and in the process. Each column, as you can see at the bottom, has a little teaching tool. And if you were to just download the forms, they give you some information that's helpful. And by going back perhaps and listening to this webinar, that might be helpful too. And then the book explains it in great detail. I promised last week that I was going to offer some additional online assistance. And so there's an app that can help with goal setting. There are free worksheets there as well for the types of concepts that we're talking about. There's an app that does journaling and has an online thought diary that I've just shown you. And then I'm also going to point out, some citations for some what I think are some very good meditation apps. One's called Headspace, another is called One Giant Mind, and another is called Breathe to Relax. So I want to show you how to find those. So I'll leave these up for just a moment so people can kind of capture these. But these are apps that fit in with the things that we've been talking about. And for people that, are younger and more tech savvy, then this might be a way that they prefer to use these tools as opposed to, more traditionally. But our website does have electronic forms that people can fill in as well. But these are apps, and I recommend them. I think they're quite good. Some more online tools that can be very helpful to people. As we mentioned, sleep is often a problem. And so there's a very good app called CBTI for sleep. And it helps people with what's called sleep hygiene practices. which can make a very big difference in their depression and overall mental health. There's an app for anxiety reduction and mindfulness practice we've been talking a lot about. And then we talked last week about gratitude. There's a journaling app for gratitude. And then for people that, and obviously this last one I want to point out, if you need this app, you need to be seen by a psychiatrist and a psychologist. But if you're having thoughts of harming yourself, there's an app called Safety Plan. And the Safety Plan app is about who am I going to contact if I start feeling that I might be harming myself. But if the depression is that bad, then you're not at a point where you should be using a self-help book. You're not at a point where you should be doing group therapy. You should be in individual therapy under the care of a licensed mental health practitioner and a licensed physician to make sure that you're safe. Okay, so let me do this really quickly. So this is our website, Anxiety and Depression Center, Newport Beach. And then if I do this properly, oh, here it is. So that's how it should work for you. And then here's the actual website. Let me just close this part. And then I'll move this over here a little bit. And then if you just scroll down to the bottom of that homepage, then you'll see the book Mind Over Mood. And if you click on Mind Over Mood, then you'll see where we have these sample worksheets that I've been using here that you're welcome to have. And then this is the book I was mentioning. The only other thing that I wanted to talk about here is if you go to self-help, then there's a link called Helpful Links. And then under Helpful Links, we have a series of guided meditation practices that anyone is welcome to use. And then they will, there's instruction about meditation, there's instruction about mindfulness practice, there's instruction about how mindfulness works and how meditation works on the brain. And then there's a number of guided meditations here that hopefully would be helpful. And then there are links for outside meditations beyond our center as well, in addition to the ones that I had up earlier. Okay. So I think that runs through a lot of the information that I wanted to be sure and cover. And now, you know, I'm certainly open to any questions, and certainly, you know, Dr. Mensah, I'd love to hear your thoughts and ideas and suggestions, of course, too.
You know, so much of what, thank you once again, Dr. Passaro. So much of what you talked about were real practical tools that I think so many of even our patients could really sink their teeth into. You know, the idea of having a little bit of guided organization and structure to kind of review how we're feeling as we move, even through nutrient therapy. You know, how was I feeling this day? How was I feeling this day? What event happened that triggered me and I didn't feel as good? Those kinds of tools I think are just stellar. I'm going to make sure that we have that available on our website for people to be able to download and access, or, you know, those apps, those are tremendous. The other thought that I had was that the tools from mindfulness and guidance, all those little meditation pearls that people can access on your site, tremendous. You know, people who are having a stressful time, people who are feeling really bad, they oftentimes have no one to turn to. Actively speaking, there's family strife, there's perspective, there's judgment, as you brought up, and these negative feelings are constant spirals. They're struck with trying to find and immediately access something that they can hold on to for guidance to help bring them down. I think those tools are really, really amazing. The one point that you talked about with regard to faith and faith in yourself, extremely important, whether it's been in humorous settings or in very serious discussions. There are cultures around the world who have ultimately all said the same thing. One of them has to do with more, I guess, the idea of flexibility, but it's flexibility to withstand the outer storm of our environment, our society, our culture, while keeping the inner peace. And I always remember what is said oftentimes in Asian cultures about being more like the reed and not like the stiff branch during a storm. The reed is always flexible, and you must learn to bend like the reed, as opposed to being stuck and firm because you break. And that's exactly what I thought of when you were talking about that faithfulness and being able to have calm on the inside and maintain that calm, find that calm place, as many people would say, during the storm. And the idea of the faith that, you know what, storms pass. They're not going to be there forever. But you've got to be grounded in that peace. It really just emphasizes so much of the difficulty that we experience on a day-to-day level, because we spend time seeing, especially if we're depressed or anxious, almost everything is a storm. And how do we survive these storms? Not well for some people. And they in turn decide in their lowest moments, I've had enough of these storms. I just want out. And they can check out physically, they can check out emotionally, they can check out cognitively, and then they encounter others, and others can't figure out why they're like that. And then that reinforces judgment upon them. And it also may actually push away some very valuable and potentially beneficial relationships that could have occurred. So there's so much that was given there. I hope everyone really got a good taste of that. And I'm glad we're recording this so that people can come back to it. There are so many great pieces. Thank you so much. That was just amazing. This is wonderful, wonderful guidance. Mr. Wells, do we have any questions yet? I'm sorry, Dr. Passaro.
Oh, no, I just was going to ask the same thing, Dr. Mensah, to see if we had questions, so thank you.
And I was just going to jump in and encourage folks to type their questions in. We do have a couple of questions, and they're actually both in the same vein. And interestingly enough, they speak to why we're doing this series in the first place. Both of them seem to be coming from current Mensah medical patients asking, how do we integrate our nutrient therapy with the type of therapy that Dr. Passaro is speaking of, and one of the questioners is asking, how do I find someone who can help me with behavior therapy, can help me with this type of training, who also understands what I'm doing as it relates to my nutrient therapy?
Well, let's just say, if we take the question part of that out, keep the content of the question, but take the question mark out, this is exactly why we're doing this webinar series. Mm-hmm. We have recognized at Mensah Medical for a while now that what is really missing is someone or a source for people to be able to go to for therapy, if you will. A place to talk, a place to feel, a place to emote, a place to discuss outside of the nutrient construct. In other words, while you're going through nutrient therapy and it's taking its time, its course, sometimes faster, sometimes slower, people need a resource to help them move through that process. And those resources are not at Mensah Medical. Quite frankly, they're not. That's not what we're designed to do. But as physicians, as caretakers, we care about our patient population and the people individually. And we've recognized that we need to be able to bridge this gap and to help our patients find those individuals to take them to the next step, even when that step is actually parallel and concurrent to what it is they're doing with Mensah Medical. So that's why I've been so excited about having Dr. Passaro. We are in the process of building a network of individuals, of therapists, of psychologists, who can now be referred to. And this is going to involve sessions of education from Mensah Medical and the Mensah Research Institute to psychologists and therapists so that they can understand exactly that, what we do and how we do it for the most part, so that they can now design, develop their protocols, mold their cognitive behavioral therapies around and integrate them with nutrient therapy. So this is exactly why we're doing these webinar series. It is well overdue that this happen. But sometimes when you're in the midst and you're so busy of putting together programs and doing all these scientific webinars and all these other things, we forget or we leave behind the person, that fragile being that is suffering. And it's not our intention to leave you behind. It's that we're trying to execute in one direction, but we haven't paid attention to try to bridge those gaps so that we can help heal the spirit, to help provide guidance to the mind, not just working on the brain. So what you're experiencing now are some of the very first steps in building those bridges and being able to get you those therapists, those individuals who can help move you in the right direction. Even as I see it, there are things that Dr. Passaro has talked about that we can incorporate to help you move through that process as soon as you start a nutrient program and begin to be able to journal and create a nice chronology and now be able to go to websites and apps. And Dr. Passaro has got also a network of individuals that we're now beginning to look to access to help you geographically. So it's not that everyone, of course, there's licensure issues, so that's one of the difficulties. We're looking to find the right therapists who will be around and available in your areas. So this is one of the big things that we're working on this year. We're very excited because we've got folks who are now able to kind of sit down and share with you at a feeling level what it is that you're going through and try to help you guide yourself into a better place while the nutrients are taking their effect. So, Dr. Passaro, would you like to chime in on that one as well?
Oh, sure. Thank you. I think when you look at the population that's served by Mensah Medical, you're dealing with a variety of disorders that certainly have a biological basis, but there's absolutely a psychological, an emotional, and a behavioral basis. So really, I think what we're trying to do is to work in a true integrative setting where we're addressing all aspects of the human condition, the biological aspects, the cognitive aspects, the social aspects, emotional, behavioral aspects. So that's really what I think we're really trying to do. And when you have these types of conditions that are treated at Mensah Medical, they're the same type of conditions that we treat in our center as well, virtually the same. But what we're trying to do here is not only to integrate that, but to integrate it in a even more sophisticated way than it's traditionally done. Which I think if you're already a patient at Mensah Medical, you've already done the patient education to get there. And so what we're trying to do in our work and our practice is to learn more and more about nutrient-based therapy, orthomolecular medicine, so that we can be more supportive in that realm. And so it's a learning experience for everyone, I think, but it is really cutting edge work. And I really do believe that this is the future of behavioral medicine. So I think it's an exciting time, and it's truly a collaborative and integrated model.
And Dr. Passaro, it is so, as we've talked about before, it is so overdue. For so long, everyone has gone to this specialist and that specialist and that specialist and that therapist and that behaviorist, and none of them have really been talking. These models, in theory, have been discussed ad nauseum, but so many times we've never seen them actually coming together. And so, we're very grateful for you. And what we're sharing now is that we're now working on bringing those folks together. It's not at all uncommon when I tell a patient, listen, we can handle the biochemical aspects of your OCD. We can handle the biochemical aspects of your depression. We can handle the biochemical aspects of your PTSD. But during all of these years, your brain has been processing and creating a pathway that has now become virtually automatic. And certain things will still trigger you and move you in a different direction. And you're going to need therapy to undo that line of thinking. What we're doing is helping to bring down that foundation and make it easier for you to move in that direction, because there isn't this biochemical dysregulation that worsens the matter. But now you've got to sit down and process. And that's not what we're designed to do. So we're going to help you find people. We're going to bring people to you and bring you to people who can help you do that. Take you to the next level, the next step. This is what we're all looking to do. And that's where we're just so excited at this point. We really are.
Very good. Want to let folks know, I've only got one more question here that's currently in the queue that I'm going to share with Dr. Mensah and Dr. Passaro in a second. We know that Dr. Passaro is going to share another guided meditation exercise with us very shortly. But while I'm asking this last question, if you've got any more questions, now's the time to get them in. But in the meantime, I've got a question here. And again, this is something that we've all talked about in the past. I've got a question here about family and supporting a family that is wrestling with someone who might be dealing with depression or anxiety or some of the other conditions that we all regularly treat. How does a family, one, get the support that they need, and also how can they be supportive of their loved one who is going through some of these challenges?
First of all, this is one of the major categories that we've been talking about a lot at Mensah Medical. Most of the time that someone is brought to us, it's not somebody showing up by themselves. There is a family unit. There's a mother, there's a brother, a sister, a father. And each one of those people represents 5 or 6 other people who are going to be immediately affected by that situation, with that circumstance. And we recognize it's very difficult for these individuals to deal with that person who looks like the loved one they either gave birth to, or they married, or they have educated and raised, but doesn't function like that person anymore. The stress is not just on that individual who's being treated, the stress is throughout the entire family. So we've recognized that family dynamics also have to be addressed in the sense of helping the caretakers, the loved ones, also through this process. And so that is yet again another topic and idea and construct that we're working to help build through our communication, through our network of therapists that we're working on developing at this point. So Dr. Passaro, thoughts on that?
Well, thank you. It's a great question, because it's a difficult thing to do. But when family members understand the treatment protocol and they can support the treatment protocol, that's really what's important. Because it's so easy to get into power struggles with people, which are going to be completely counterproductive. And although cognitive therapy is a educationally based therapy model, in other words, you're teaching people tools and teaching them skills, what can happen is that, and we do this a lot in our practice, we also teach those same skills to family members. That can be done through, if the patient is an adult that gives permission, we can absolutely talk to them and say, here's what we're working on. Here's how you can support your loved one's treatment. Very common practice. If someone's using the book Mind Over Mood in their therapy, for example, then if family members also have a copy of that, it gives them an understanding of here are some of the protocols that are being used. So some treatments, like OCD treatment, for example, is something that's very counterintuitive, and it's very easy for a loved one to think that they're doing the right thing to help the person with OCD, but actually what they're doing is actually making the OCD worse. So it's an excellent question, and being able to collaborate with the team, with the physician. When should he be taking these meds? Should he be taking these meds in the morning, at night? How can I help, get compliance? That's where all of us can work together. But when you do have loving family members who understand medical treatment, who understand the cognitive and behavioral treatment protocols, that's going to absolutely dramatically increase, the probability of good success. Because when the person's trying to do it on their own and they're overwhelmed and perhaps not as compliant as they should be, it's going to lower the treatment outcomes.
Very good. Thank you, Dr. Passaro. We do have one more question that came in, and Dr. Mensah, I've got someone here asking, saying, we know this is kind of a general or broad question here, but is there anything that a person can be taking right now, nutrient-wise, supplement-wise, to support their mental health during this time of uncertainty and the like, in addition, of course, to any other medications that they might be taking?
Absolutely. And if I were wearing a black bandana with a mask here and were carrying a sword and had a Spanish accent, there would be a giant Z that I would scratch across the screen. And the Z would stand for zinc, my particular favorite element. While we are talking about depression, while we're talking about anxiety, I am so proud of modern medicine now, because when you go to WebMD and you Google nutrient treatment for depression, zinc shows up. I was so happy, because how many times have we been told micronutrients mean nothing? So now let's talk about this for a minute. Now, most of you out there right now are on nutrient programs anyway, but if you're not, here's a very interesting thing you can do. I generally do not do this because I feel and still exert that you need to have your chemistry tested. Right now, we know that most people aren't going anywhere because we've been asked not to. But there's still, most people, I guess, you've got your fingers, you've got the internet, so you can go online and order. You can order zinc. If you're an adult, a modest dose that is not going to, for the most part, hurt anyone if you're not on a nutrient program already, is 50 milligrams of zinc. And the form of zinc you want to take is called zinc picolinate. That is P-I-C, pic, O-L-I-N as in Nancy, A-T-E, zinc picolinate. Why zinc picolinate? Really, that's the best and most absorbable, consistent form of zinc. So there are many forms of zinc out there. Zinc citrate is actually more powerful than zinc picolinate, but it's only about 30% absorbed. So if it says 50, you're only getting about maybe 20 or 10 milligrams of zinc total, okay? But zinc is a great element to take. I can say this because really, not just most of America, but most of this world is zinc deficient. The population across all countries, for the most part, has very sub-therapeutic levels of zinc in their system. So while many doctors will go, oh my gosh, it's a huge amount, that's toxic. No, it's not. When you are treating individuals in the world of mental health, that dosage of zinc for an adult is oftentimes actually not therapeutic for treatment, but far better than what you get in a multivitamin, which is oftentimes just 5 milligrams of zinc. Okay, that can actually help support you in a variety of areas. The other element I would talk about is vitamin D. And Dr. Passaro, I'm sure you're in agreement. Vitamin D is very, very powerful. Most people are vitamin D deficient, and they'll say, gosh, I've been out in the sun a lot. And I spend plenty of time in the sun. I have news for you folks. The sun, the earth, our atmosphere, and our absorption capacities are not what they used to be 20 years ago, okay? These days, even dark-hued individuals cannot get enough vitamin D from being out in the sun, okay? And trust me, I come from a country where everyone is about several shades darker than I am by birth, okay? And they are vitamin D deficient and out in the sun quite a bit. So first, I say usually about 50 milligrams of zinc. I also recommend vitamin B6. And for vitamin B6, for most people, I would say about 100 milligrams is a good start. You were talking about just adults, someone over 100 pounds. Zinc, vitamin B6, and vitamin D. Now, there's a huge spectrum of utility for vitamin D. And, many people will say, well, I had, 1,000 units of vitamin D, or I had 2,000. I would say that 2,500 international units of vitamin D is a good starting point. Again, we're not talking about therapeutic treatment levels, but things to kind of give you a little bit of support. Okay? Vitamin D, let's be clear. Vitamin D is a hormone. It is not a vitamin. And why is that significant? Hormones travel throughout your entire body and have ramifications for multiple systems. They're kind of like, air molecules that travel across the country, okay, that travel across oceans. Think about your body as the entire planet, and this particular molecule will just travel from continent to continent in the air, and it affects you. Very, very powerful is vitamin D. I don't talk a lot about vitamin D because most people usually have their own source, or they've got their form and what they want to do with it. But if we're going to ask what we can do right now, especially if you're feeling down and depressed, zinc, vitamin B6, vitamin D, these are all very powerful agents. Now, please understand, we're being very general. We're not talking about, well, if you've got a hidden thyroid condition, this is going to supervent that. And it's not. I mean, you do have to correct physiologic problems like endocrine issues, thyroid, diabetes, etc. But if it's simply a question of what can I do to offer a little bit of support, these are really sort of our top three. Okay. And I know a lot of you are going to think, well, I like, what about magnesium? And what about, beryllium? And what about zirconium? And zirconium is a fake thing you put on your ring finger, but it exists. You don't want to ingest that. These are not the power hitters in our world. Not that they're not significant or important, but perhaps they're just not the biggest piece. Another thing we've been talking about that I do want to recommend, not just about nutrients, but also your diet. No nutrient is going to override a very, very bad diet. In therapeutic forms, you got a chance, but we're not talking about therapeutic forms. You have to undo a lot of the processed foods. You've heard this a million times. You've got to undo a lot of the inflammatory foods like grains, pastas, breads, cereals, pizza, cheeseburgers, all my favorite things. They've got to go. When we are feeling down and out, we have to ask ourselves the question, what did I eat? You'd be amazed. An hour or two later, your mood changes. You affect your family member. They're mad at you for days. We've been through this, okay? And you go to apologize and say, you know what, I'm really sorry. It was the slice of pizza I had. And they go, yeah, right. You just don't love me anymore. It can be that kind of serious. It can be that kind of humorous. But the thing is, your diet affects you. Your diet affects your kids. You may give in to giving your child that McNugget that is glycosylated, dipped in grease, re-sugarized, and then breaded, and then re-dipped in that same grease. And you're wondering why your kids are hyperactive 45 minutes later or moody. And then you take them to Dr. Passaro asking, Johnny just isn't behaving. He's got a behavior disorder. You've juiced him up. You've created yeast in his GI tract. The yeast are now running amok with his brain, and he can't process. And he's on alcohol because you fermented him inside, and now his entire chemistry and system is off. We have to look at our diet in this process as well. So while we're at home, and it's hard because we can't go out as much, so everything that we order a lot of it is takeout, and a lot of the takeout food is not the best. But even then, we can find the silver lining in a lot of those menus, okay? So this is a great time to clean up your diet while you're doing nutrients, while you're working on your own mindfulness and being present. It's a great opportunity right now to actually build in that time. Dr. Passaro, that was one of the things I loved about your paperwork there and your forms. You can build in time for self. You say, I never have any time. That's not true. Every single person can take 5 minutes. Or if you're ultra efficient, maybe take 60 seconds to write something down about what you want to do for yourself and when you want to do it. And once you do that, you'd be amazed at how your stress level goes down, because you know you've actually created a space that you will find where you get to take a break from everything else. Okay. I know that was a long-winded answer. We started out with just nutrients, but it is very important to be careful and mindful of all those things.
Very good. Thank you, Dr. Mensah. And while I want to be careful that, our intent in doing these webinars is certainly to share good information, and not to be a commercial for Mensah Medical or for the Anxiety and Depression Center. Do recognize, folks, that both of our organizations are resources for you. And so that said, if you go to the Mensah Medical Facebook page, we'll post the link to this video. We'll upload the video replay of this particular webinar to our YouTube channel, and then make it available via links on our Mensah Medical Facebook page. But also on that Facebook page are a number of other webinars that we've done very recently, including a webinar, a 4-part series that we've done with a nutritionist who speaks very eloquently to many of the things that Dr. Mensah just mentioned. Also, if you go to the Mensah Medical website, many of the nutrients that Dr. Mensah mentioned are available for folks to purchase, and we can ship them to you from the Mensah Medical store on our Facebook or on our website page. So please do make use of the resources that are available to you. And again, don't like to commercialize things too much, but certainly want to make folks aware of the fact that those resources are available. Dr. Passaro, you promised us another guided meditation session, and so I want to offer you the opportunity now to take us through a session.
Great, thank you. So I wanted to thank Dr. Mensah. That was great. That was such a wonderful description and just so absolutely true. We see it in our practice all the time when parents bring children in. I think they're always surprised when one of the first questions I ask them is, "Tell me about your child's diet." So, and because it's what Dr. Mensah said is exactly what I hear. It's not a healthy diet, and the parents themselves, and we have the parents chart this data, and you can absolutely see the data that supports what Dr. Mensah is saying. I feed him this, and here's what happens. I feed him that, and this is what happens. So it's an easy behavioral experiment to do, and we encourage all parents to do that, to see the role that diet can have in a child's behavior. Certainly not 100% of the issue, but a very important component that's often overlooked. So thank you, Dr. Mensah. That was awesome.
Thank you.
So we're going to do a little guided meditation then. So my recommendation would be to find a comfortable posture, and you want to, if you're going to be in a chair, just have your feet on the ground. Your back, can be braced by the chair, but try not to be pushing back. Try to keep your spine straight, shoulders slightly pulled back, chest pushed slightly forward, ears back over your shoulder, chin parallel to the ground, hands at the junction between the thighs and the abdomen. And what we're going to do is a little relaxation exercise. So what we'll first do is we're going to breathe in, and then in a wave from our feet to our head, we're going to tense all the muscles in our body, and we're going to hold that for a second. And then we're going to exhale, and we're going to completely relax. And we're going to do that 3 times. So let's breathe in, tense the entire body, hold, breathe out, and completely relax. Notice the difference. Breathe in intense, hold, Exhale completely and relax. One more time, breathe in. Tense, vibrate with energy. Hold, exhale, and completely relax. Now, what we're going to do is we're going to tense and release specific body parts. So tense your left foot, feel the energy in the foot, hold, relax. Right foot, tense and feel, relax. Notice the relaxed state. Left calf, tense, hold, completely relax. Right calf, left thigh, right thigh, left forearm, right. Concentrate on that individual body part. Left bicep, right bicep, stomach, left side of chest, right side of chest, left side of the neck, right side, front of neck, back of neck. So just notice the body now for a minute. After doing this exercise, notice if you feel the difference now in the body, that the body is now more relaxed, but also perhaps you feel some energy in the body after doing that exercise. So that awakens us and relaxes us to now go into meditation. As we did last week, we'll do a little breathing. So we'll breathe into a count that's comfortable, hold to that same count that's comfortable, and then exhale to that same count. And we'll do that just a few times. So breathe in to whatever count is comfortable for you. Hold to that same count, and then completely exhale. And then just find the pace that works for you. And concentrate particularly at that place between the inhalation and the exhalation where there's no breath and the mind is very calm. So now you've calmed and energized the body, and you've calmed the mind. What we've done now is we've really prepared ourselves to meditate. This is preparing the body and mind to meditate. So now just when you reach the next exhalation, just breathe out and now completely forget the breath. Don't pay any attention to it at all. Let it breathe naturally on its own. And what we're going to do now is a mantra. And the mantra that we're going to use is as you breathe in, you mentally say, here, and as you breathe out, now. Here, now. Just mentally repeat that to yourself for a few minutes. It helps now ground you in the present moment. There's no future. The future doesn't exist. The past is gone. There's only the eternity of the present moment. Here, now. When the mind wanders, just come back to the mantra. As you inhale, here, when you exhale, now. Mantras are a very effective way to help keep the mind focused during meditation. Now that you've calmed and energized the body, you've calmed the mind, and you've brought the mind into the present awareness. Now what we want to do is we want to cultivate faith in our practice now. Faith in ourselves, faith in our lives, faith in our future, faith to face the challenges that we have. And we do this with affirmation. And we're going to affirm. And what I'd like everyone to do is mentally repeat after me what I'm going to say. So just mentally repeat this. I relax and cast aside all mental burdens, allowing peace to flow through me. I relax and cast aside all mental burdens, allowing peace to flow through me. I relax and cast aside all mental burdens, allowing peace to flow through me. I relax and cast aside all mental burdens, allowing peace to flow through me. And after repeating that affirmation, we want to just take a moment to try to allow the mind to sit in the silence, with the body still and calm and energized, the mind clear and sharp. We want to sit in the silence. And sometimes in life, the silence doesn't last long.
It sure doesn't. Well, no, it is hilarious. Yeah,
So happy Passover, happy Easter, and happy Buddha's birthday to everyone.
Dr. Passaro, if I can ask a quick question.
Of course.
Regarding the affirmations and the mantras. In the past, I've read, I've heard other people talk about some of their meditation techniques, and they've found very, I guess, a series of positive words, love, happiness, success, et cetera, et cetera, et cetera. Do you recommend those types of affirmations or mantras as well?
Absolutely, yes. The thing that we want to think about, there are a number, there are countless meditation techniques, but the ideas of more active and engaged types of meditation that involve visualization, involve mantra, can be very helpful to people. I know that when we spoke, Mr. Wells, you were, an athlete, and so athletes do visualization all the time. And so there's no reason that we can't be doing visualization and affirmation the way athletes do, for the changes that we want to make in our life. If we want to be calmer, more peaceful, we can affirm that. If we want to be more loving, we can affirm that. If we want to be less irritable, less angry, we can affirm that. When we affirm positive things, we can make changes in our mind, just as we know that athletes visualize making a three-point shot, can do that. The research is so interesting that that visualizing an activity can be as effective as actually doing it. And so we want to use our meditation, because if you think what we've done, we've calmed the body, we've calmed the mind, and now what we're doing is we're rewiring the brain the way, Dr. Mensah had mentioned. We're doing this activity of neuroplasticity to change some of these habitual patterns. And so absolutely, it's a wonderful question. I'm glad you asked it. Affirmation and visualization are important techniques in many meditation practices, certainly the tradition I was trained in.
Outstanding. Thank you so much, Dr. Passaro, for all that you've shared with us these last couple of weeks.
My pleasure.
Dr. Mensah, any closing remarks before we let folks go here?
Again, I just can't be grateful enough for all the wisdom and knowledge Dr. Passaro has really shared with us. Some things we just take for granted, whether it's journaling or just reaching out to find that quiet place and positive affirmation and these kind of tools that he's brought, those are real gems of application that we can all use. And we just want to say thank you once again. It was great. And we're looking forward to the next step in our evolution of relationship so that we can bring the Dr. Passaros of the world to as many of our patients and people that we know as possible. So Dr. Passaro, thank you once again. And have
pleasure.
a great holiday season.
You too. You too. Thank you so much. It was my honor to be with you.
Thank you to all of you who have taken the time to be with us here today. Again, you can look for a video replay of this on the Mensah Medical YouTube channel, and links to it on the Mensah Medical Facebook page. We should get that up later on this evening or sometime early tomorrow. Share this information, share these wonderful tools that Dr. Passaro has shared with us, with your friends and family and colleagues. Guide them to those videos. And again, we intend to keep these conversations going. And so hopefully we'll have Dr. Passaro join us again sometime in the not too distant future. Until next time, and again, please do keep your eyes and ears open. We'll be sending out announcements in the next few days as we line up even more people who can help us through these uncertain times. Until then, thank you so much for joining us, and we'll see you all soon.
Thank you.
Thank you. Thank you.